Hello and welcome to this video on psychological first aid. My name is Amber Ovens and I'm an assistant psychologist working for the Norfolk and Suffolk Foundation Trust. In this video we're going to talk about what psychological first aid is and how it can be used in a pandemic. The official World Health Organization definition is a humane, supportive and flexible response to a fellow human being who is suffering during or after crises or emergencies, like the current COVID-19 pandemic. In more plain terms, this means an immediate assistance given to anyone suffering psychologically because of a crisis, with the aim to preserve and protect their psychological well-being and prevent it from worsening. Psychological first aid consists of a set of skills that are based around rescue and recovery, with the aim to prevent the development of post-traumatic stress disorder. Post-traumatic stress disorder is a psychological condition that carries some very distressing symptoms, such as nightmares, flashbacks, and intrusive memories. It can also cause changes to one's mood and behaviours. So psychological first aid tries to prevent this through providing practical care and support, helping to address basic needs, connecting people to information, services and social support, comforting people and helping them to feel calm, reducing distress, and then protecting people from further harm. It is also important to note the similarities between physical first aid and psychological first aid. So it is not something that everyone will need, only those who are struggling. It is an immediate response and not a complete treatment. Therefore, just as how physical first aid does not include surgery, psychological first aid does not include in-depth counselling or psychotherapy. In addition, like physical first aid, it is not something that only qualified professionals can do. It's also important to recognise what psychological first aid is not. So it is not something that everyone affected by COVID-19 will need. It is not counselling, nor is it psychological debriefing, in that it does not involve detailed discussion of the events that are causing the distress. It is not asking a person to analyse their situation, nor pressuring the person to talk about their feelings. And it's not something that only professionals can do. So, who can psychological first aid be done on, when and where? Well, psychological first aid can be done both on children and adults, but the key point is that it should only be used on those suffering and should not be forced upon everyone. It needs to be individualised to the person and their needs. Psychological first aid can be used as soon as practically possible and should be continued during and after the crisis. It should also be carried out in the safest place, ideally in a more private area for confidentiality and respect for the person's dignity. However, before you start offering psychological first aid, it's important that you have the accurate information and keep yourself up to date. So make sure that you learn about the current details and facts about the pandemic. Make sure that you have relevant, current, local and national advice, guidance and instructions. Know what services are available for what kinds of support. Learn about the range of reliable, accurate resources for support and resources. Know when, how, why and where to access additional wellbeing supports for those who need it. Find out who else is helping, what are the local community and online supports, and finally, are there any immediate or ongoing dangers or security concerns? If you're offering psychological first aid remotely, for example via telephone or video link, make sure that the mode of communication you're using is safe, secure and easy to use. Make sure that there's sufficient time for technical troubleshooting. Make sure you speak slowly, clearly, calmly, communicating with empathy and warmth. Make sure that you and the caller both have your own private space to complete the call, ensuring that you will not be overheard or interrupted. Once you've established the caller's needs and that you're both clear on how much time the call is expected to take, make sure that you also know your own limits and that you know when and how to refer a call onto a supervisor. Finally, why do we use psychological first aid? Well, psychological first aid has also been used during other outbreaks such as SARS, Ebola, and other disasters such as the typhoon in the Philippines and also after the Haiti earthquake. So any initial response to a traumatic event needs to be supportive, practical, and empathetic, hence why psychological first aid is often used as it's been shown to be the most effective tool to use in a crisis situation. Thank you very much for listening to this video. That is the end.